We welcome you all to Talk the Talk. My name is Janine Stiene,
And I'm Toni-Ann Antoniato.
the masters of myofunctional therapy.
Together, we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving. We welcome Mary Bourke to this episode of Talk the Talk. Mary is a chiropractor and the CEO and clinical advisor for Myo Munchee. Mary lives in Australia, where she continues her father's legacy with Myo Munchee. For those who do not know, Myo Munchee is a small chewing device that is used to support oral function for proper facial development, jaw growth, and swallow patterns. Mary has become a dear friend to Janine and I. We have had the privilege to collaborate with Mary on Munchee and Spot Pal, and we adore her and are so excited to have her on this episode of Talk the Talk.
Great to be here with you two as well.
Thank you for joining us. I know the last time we spoke, there's just always so much to talk about, and just hearing how Munchee evolved. I know I've heard bits and pieces, but I haven't heard everything. And I think it's an important concept of like where that all started and what was the catalyst to creating it.
Yeah, and I think you guys, out of anyone, would understand that as these are the catalyst. What is it that sparks the idea? You guys are inventors yourself of a product too. So my father, was the developer of this product, and 1960s Australia was he was fishing on an island off the coast with some mates, some friends, and he came across on the beach the jawbone of an Indigenous Australian. And he looked at this jawbone, human jawbone, and went, and he's a dentist, and he looked at it and it really struck him the difference of the bony architecture and the solidness of that jawbone, that mandible, compared to what he was seeing in his practice. And the teeth were firmly rooted into the bone. And it really got him thinking, because he was dealing with a lot of really poor oral health conditions. So the gums were really in poor condition, the teeth were falling out, there was a lot of cavities. So that was 1950s, 1960s dentistry in Australia. It was a lot of that. So that really was his big interest, was periodontal condition and how to help these people who had all these issues. So that was the original premise of the Myo Munchee, was those little prongs that are on it. They're for massaging the gums, the gums and cleaning the teeth, salivary production. So that was the original premise of the Myo Munchee. It was for improving the oral hygiene and conditions of the population. And it did a great job at that. And that was great. So that was Dad's big interest at that time. He got interested as the time went on a little bit more. 1970s, he had 6 children. Three of his older children, I'm the youngest of the 6 children. Three of the older children ended up with extraction retraction orthodontics.
Yeah.
And particularly one of my sisters, he looked at her face and went, oh, her face had stopped growing. He'd sort of saw what happened. And so that became his next thing. How do we prevent that occurring? And he started to look at the Myo Munchee for growth and development. And that was the big passion through most of his life. So that's sort of where a lot of his thinking as a dentist was around the Myo Munchee, was oral hygiene. We know it's great for clearing the plaque. There were studies done at Osaka Dental University in the 1970s with children to look at removal of plaque. So those little prongs and production of saliva really helps to clean the oral cavity. So it's a fantastic oral hygiene tool. And then it's also been utilised a lot in dental environments for growth of the jaws and the face, for the teeth. So they're looking at the teeth positioning and things. And it was interesting with Dad back in so I grew up with this passion and interest for this field, and often in the kitchen at night, he would have these carousels with slides. Remember those carousels at all?
Oh my God, yes.
Where you click the little things
and it made that movement, like that sound.
Yeah.
It was like Yeah.
And the next one loads, that's right. So I grew
Yeah.
up with before and afters on the wall in the kitchen. He'd have the kitchen bench with these carousels going, and he'd have a before slide up, and he'd have and he'd start. He was seeing change in these children's faces and their teeth, and he was like, "Oh." And so I found some of these things after he died, and one of them was this letter that he'd sent to a Dental university to say to them, "I think I'm seeing change in the bites." And they said, "Yes, we've seen that too in over 200 cases." It was not a rare thing. When you get the child chewing that munchie, it will change the way the jaws are in relationship to each other, which will affect the way the teeth land.
Wow.
But around this time, he was also really interested in talking to speech pathologists. And so he was going to meet with these speech pathologists who were interested in this, what he was finding. And he got a complaint made to the Australian Dental Association about the fact that he was teaching dental or whatever to speech pathologists.
Oh,
And
no.
Oh my
so
God.
he stopped being able to do that. And it was just that very interesting, weird, we get very defensive around our turf.
Yes,
And
of
he
course.
hit that way back then. Yeah.
Wow, that's
Wow.
amazing. As a child or as a youngster, how did your father explain this product to you? And ultimately, as it continued to evolve, did you continue to be involved? Did the changes that have occurred, were those all ideas of dad now? Or there's like even the mini, is that just coming to life? Or are these things that you've revolutionized since you've taken over?
Yeah.
Yeah, so red rubber munchies were the ones that Dad originally had. They looked like that,
Okay.
but they
Okay.
were made of red rubber. So we
Okay.
were the trial candidates of that. So I would
Okay.
have been, I don't know, I probably would have been about 8 or 10 when I first started, working with the red rubber munchies.
Wow.
Yeah, so, and my brother, who's 2 up from me, he recalls Dad saying to him, "If you chew that a lot, you won't have to get braces. Get onto it." So Pete got very busy chewing this munchie.
And the orthodontist had a hit out on him, Mary, right? Like, oh, you're
Well,
killing our
they
friend.
did. Yeah, exactly. They weren't having a bar of this. They weren't having a bar of it. So it was quite interesting because Dad brought John Mew to Australia in the 1970s, like 1974 or something like that. Dad was really interested in John Mew's work, and he thought, "Oh, the orthodontist will be really interested in what this guy's got to say." And
Yeah.
well, no, they were not interested at all. They were so uninterested. It was
Wow.
quite,
Wow.
yeah,
So sad.
It is really
very
sad.
scathing, in
Yeah.
fact.
Yeah.
Wow.
So
So,
50 years later, interesting, isn't it? That we're still, but we
yeah.
are getting the change now. We are getting, there's a lot more thinking, curiosity, and looking to solve these issues now. Yeah.
Right. A lot
He
more
was one of the pioneers for
orthodontists
sure.
being okay
And
with
so
it
he
early.
had developed the one for children.
Yes.
So the big change I've made is conditions for use and really starting to look at it from different angles and perspectives and applications and going really broad with that, trying to get it out of that dental space, out into the functional space. And, you're a speech pathologist, I'm a chiropractor. We're the people who are, and I think we're two great communities that really get great benefit from using a munchie. So I've really tried to put a lot of those protocols for use out there in the education. And then I developed the BB munchie, the one for 6 months,
Yeah.
because, you sort of just realize the longer, because in my work as a chiropractor, I see people across the lifespan. So I'm seeing them from early on, and then often I'll see families and I'll keep seeing them along the way. So you start to sort of realize that those issues were always there, and
Right.
people who would come into me as adults later in life, and you're like, "Oh, I know where that came from." So you eventually have to just go right back to the beginning and go,
Right.
"Okay, why is this here? And what is the piece of work that needs to be done to allow that system to get back on track?" Because it's really trying to get the functionality working again. And I think we're both on the same track with that, with really trying to rewire and get all that chewing function. It's a faculty, the chewing faculty.
Right.
I've sort of more and more and more realized how important chewing as a functional movement for humans is, and how more and more we've lost connection with it over the last well, it's getting worse, 20 years, but the last 50 definitely. And and I think what twigged me to that was I was already working in my chiropractic pediatric. That was always my interest, is early development. And I read, we speak a lot about the importance of all the early movements, rolling and crawling and not, sitting them too early and making sure they do all their milestones. I realized that chewing was a milestone movement.
Mhm.
And I thought, okay, that's a conversation I've got to try and push out there because I couldn't find too much information because I know the speechies have the speech milestones. You have very clear milestones in that way, but I thought, where are the functional movement milestones? Where are the things every child needs to just nail and that we can track before it becomes a deficiency and they've got a symptom picture? That's what I was really interested in. Where are the signs of dysfunction before it becomes symptomatic and they end up in the speech office, OT office for, intervention therapy?
Right. Yeah.
Wow.
I think it's important to just say to the listeners that the munchie is not just a tool when there is dysfunction. You know, it could be used on a healthy baby who you just want to keep things moving well and nicely. As speech therapists, we use it a lot in therapy because it's a really good, especially home carryover tool to do at home for the families, but it can be used in a more proactive manner also.
Yeah, that's a great point. Thanks, Toni-Ann, because that's right. I would love to see it standard for every 2-year-old to chew.
Right.
That's kind of my mission is
Yeah.
every child at 2 is chewing a munchie because we didn't always need a toothbrush as humans. Humans haven't always had a toothbrush.
Okay.
We now don't just need a toothbrush, we need a chewing tool as well.
Right.
Mhm. Yeah.
We really realized how essential those early growth windows to
Mhm.
activate. If you don't activate into those, they can't get their optimal expression for the growth, the genetic growth. It's really interesting listening to Kevin Boyd, for example,
Yeah.
talking about the 3D growth matrix of the face, And chewing is what you've got to put in there. You've got to put an input in as
Right.
well as that tongue function. They're the two pieces that will have a massive impact on the way the face grows. And the examples he uses are things like the eyeball. It's the eyeball movement that grows the socket. So you've got
Wow.
to have the functional eye movements to get the ideal socket growth.
Right.
So these functional matrix as we're growing and developing there's certain inputs that are allowing this growth to occur in the ideal proportions. And that's what we're really missing. When you don't get those inputs, the face will not grow. And he talks about the long bones. Genetically, we have a certain program for how long they will be in our body. So it wouldn't matter really what you did. You won't affect the growth of those particularly. But he said the face is not the same. You will not get your growth. So you might have a genetic program for facial growth, but it won't achieve that if you don't put the inputs in. So it is really interesting to see that we have to. It's non-negotiable. Yeah.
Right.
Absolutely.
Especially as we continue to have more, processed foods and pouches and all those kinds of things that these kids are eating, they need to be chewing. They need to be on that baby-led weaning type of diet and whole solid foods.
Which is
And
interesting you
you're
say that.
right.
Yeah,
Okay,
I'm
sorry.
sorry. Only because my daughter's friends eat the puffs like babies eat, like they're the puffs that dissolve in your mouth. They bring that as a snack. It's mind blowing to me.
Yeah. Yeah.
Yes, and because you're right in the firing line of seeing exactly where it goes.
Yeah.
Feeding and speech are the two big deficiencies that we see straight up when we don't get that optimal facial function happening early on. That's what chewing is, that big foundational movement to really get those two things happening, isn't it? You need that jaw grading stability, all the things, all the complexity that you guys deal with. There's so much complexity. I'm always blown away by the understanding you have around all of the nuances of what's required for speech. Wow.
A lot.
There's a lot, exactly. What were in your practice, what in that demographic, so say that 2-year-old child, what types of things were parents coming to you for? And what ultimately was the result of those sessions or those appointments?
Yeah, so these days most people come to me for facial stuff. They've heard, oh, okay, well, so I'm trying to remember back to before I was the old
Yes, of
facial
course, sorry.
person. But yeah, so that's a lot of them are tracking, looking at, delayed milestones, a bit of low tone, but they're not classifiable for OT, for example. We're working with the kids who are in the grey area of dysfunction, and the parent might just be bringing them in for a checkup, and then we're spotting that actually, yeah, their feet are collapsing a bit, the knees are rolling in, the pelvis isn't stable. You can just see that there's less than ideal activation in that system. So then we're working through our work with the spine, with the joints and things to improve the level of activation in the system, trying to make sure those primitive reflexes have integrated. Often they'll have retained primitive reflexes. So we're doing work to enable those reflexes to integrate, and then giving movements and things to ensure that's done, and then trying to get the postural activation occurring. So it's kind of looking at where they're at, seeing what's not quite nailing in as well as you'd like. And often those children, so children with neurosensory sort of issues, any of the children who are sort of on the spectrum can benefit hugely from chiropractic care, that hands-on work, getting that nervous system integrated and regulating better, as well as the fact that we think about all of our balance centers. We've got visual input, we've got proprioceptive input through the joints, ligaments, tendons, and then we've also got the balance centers, the vestibular. So in that cerebellar postural system, we can do a lot to get all of those systems firing, because so many kids are firing off their visual system way more than they should be.
Wow.
Because the other systems aren't really well established and integrated, or getting the activation they need, because they're not out and about. Remember those? I was just thinking about those big things at the park. You're probably not as old as me, so you might not remember.
I know.
You run around, and they're
Yep.
probably very dangerous, running around the
Yes.
outside. Those things.
Yep.
How were they good for getting all of the activation of all of the awareness, all those things that we kind of have gone all safety on, create issues around children's ability to learn their own depth perceptions and how they relate to other people, other situations. I remember seeing this child go off this high, I think because he had no idea, had the depth perception that wasn't a safe distance to jump off.
Wow.
There's so much involved, similar to your jaw grading and nuance and all that awareness. The body posture has to have the same. I'm always surprised at how similar the body posture and the oral posture are in their requirements to get optimal function out of them.
Yeah.
Absolutely.
Wow.
Did your patients think you were crazy when you were recommending a Munchee for their issues when they're coming, for something completely different?
Yeah, it is interesting, isn't it? Starting the conversation around, oh, what are you looking at my mouth for? Why are you?
Yeah.
Yes, it's these days it's just a standard part of all of my consults. And I guess I've always had an interest in it because of my dad. So I was always pretty confident with what I was approaching. But I can understand, yes, it's not what they're expecting you to talk about. Similar to if you guys are looking at posture and saying, oh, I can see that, as I know you do as well, look at things beyond your area of expertise. But we all have to do that, don't we? We all have to put our work in context of the bigger picture. But 100%, we definitely get people want to hear what the dental people have got to say. And so I would work very closely with a dental hygienist who had a lot of really good training around this. So, that was always the thing. You just said, okay, they need to go to the teeth people to get that verification that that's the right tool for them, and that's fine. Yes.
Absolutely.
It all is definitely connected, and now even with all that we know about the fascia and how everything is connected, it's, all related for sure.
Research is blowing our minds, day in and day out, but it's so needed. It's been so long without research, especially here in the States. And even a lot of the medical professionals here would not accept the research because it wasn't done in the United States, which became very frustrating, especially because parents would come to us. We would make all these, connections or say, this is what we're concerned about. You need to see this person, this person, this person. And once they went there, there was like a brick wall. Like they were not supporting that what we needed to get, the child or whomever to what their goals were. And it's exciting to see more and more research coming, and more awareness with regards to chewing and swallowing and posture and breathing. And
Yeah.
it's amazing to me. Like it's like something that is so antiquated, right? We've had it forever, but yet it's like this revolutionary idea. Like, oh my God, look what we need to do. Breathe through our nose. It is a little nuts.
New.
Yeah. And Mew, exactly. Yep. And I'm
And I
mewing.
think that's part of it too, is we're always looking for these very complicated answers. Oh, it couldn't be that simple, could it? Well, actually, it could.
Yeah.
Like, because
Speaking
even
of
for chiropractors,
skills.
probably one of the biggest things you'll ever have impacting a posture is the way they breathe.
Yeah.
It's the same for so many of us.
Yeah.
You go, oh, okay, I've actually got to try and resolve that issue rather than be treating these things over here. We've all got to sort of try and unpick it a bit. We've still got lots of work to do to treat things, but we also really want to get to these bigger pieces, like you say, and get the word out, because
Yeah.
they're the things that'll set you up really well with your health.
Yeah.
Those
Yes.
basics in life, and we have lost a lot of connection to them
Mhm.
because of the busyness and not realizing that we're missing. Oh, oops, that they were they're the core pillars of health,
Right. Yeah.
Right,
Yeah.
right.
Yeah.
Back to the basics. Keep your mouth
Back to the
closed, breathe
basics.
through your nose, and suction your tongue.
And away you go, right?
And get off your chair. That's the other bit
Yeah.
too, because
Yes.
that's another that's the new big issue now, is the sitting all the time,
Yeah.
which locks the diaphragm down, doesn't allow the breathing properly, shuts all the balance centers down. Yeah,
Yeah.
it's a bit of a disaster, but
Are you practicing chiropractic at all? Are you 100% Munchee?
Right now I'm 100% Munchee. Yeah, I
Okay.
just finished seeing patients in November.
Okay.
Recent.
Wow.
I just had to kind of, which is interesting. I would never say I'll never go back, but yeah, it's kind of
Yeah.
interesting.
Absolutely.
Had to
You know
let
what
my
needed you in the moment.
Yeah.
Yeah, and it's hard when we love our patients and our clients we work with, and especially people I've been seeing for a long time over the years. It's really hard to go,
Absolutely.
someone else can look after you.
Exactly. Yes. Yes. Exactly. There's other persons out there, just they're not as good as me. That's good to say. So once you start practicing again, you got to come back. Where do you see Munchee going in the future?
Wow. Well, yeah.
I don't want to
really
break any secrets if it's a secret. So yeah.
no, it's not a secret. I think that's the mission, is to get every child chewing. So
Yep.
that is what we're really working towards, is working on trying to get more good information out to the public. I think is what our next big step is, to go really strongly and clearly to the public. We've done lots of work with practitioners over the last 5 years, probably has been our big push. And that's been really important to me, because I knew I could have sold a lot of munchies, but I didn't want to sell a lot of munchies. They only work if you actually do it.
Right.
You only do something if you do it. And if
Well,
you don't have a big enough why and understand it and believe it, then you won't. And that'll just be another thing that a parent bought that didn't have an impact. So that's been really, really important. And we've got thousands of practitioners around the world now who are really understanding, and the wave of change is coming, where, like you say, the people that we can now work in teams and collaborative, because we do have other people who are understanding these concepts. And I think the public get it. And do you find that in your practice as well, that they come with, I get blown away by, like, okay, they've looked at stuff. They know what's going on.
Agreed. We say within the last 2 to 3 years, it's like our intakes for patients that are coming for therapy or for an evaluation, they're saying the myofunctional therapy, they're saying mouth breathing, they're saying snoring. It's the parent, and we used to never get that. It used to never be the parent. It would be the orthodontist said they have a tongue thrust, or now the parent is becoming really educated, which is powerful.
I think it's also interesting that you just lectured to 100+ dentists, right? And obviously they signed up for the course, whatever. And amazing that 100 people here on Long Island wanted to know more about myofunctional therapy and the tools used. Where in the past I would give lectures and they would be the people were old and they would just fall asleep on me. So I'm like,
Right.
this is ridiculous. They're just here for your SKUs. So I'm out, Now they're
Yeah.
asking educated questions.
Right.
Now they're
Right.
looking for us to do these lectures. It is interesting.
Can I ask you a question?
Of course.
How did you first get into this, or both of you get, because you've got amazing knowledge and understanding of this field. What was the thing that first tweaked for you guys back when you first started to go, I'm going to really look at that? Because what was your need? What made you go and get outside your square? Because really it was kind of outside of your box, wasn't it? Traditionally.
Yep.
With myofunctional
Myofunctional therapy.
Yeah.
I worked in the school districts here on Long Island. And when I came in on my first day, the woman was still there that was retiring, and I would take over her position. And she gave me the name of this man and said, we refer all of our tongue thrust cases for myofunctional therapy with this man. First of all, I had no idea what a tongue thrust was, especially beyond like that infant stage. And I had never heard the word myofunctional therapy ever. So then I called him and we had lunch, and he was looking for someone. He wanted to retire, so he was looking for someone that would take over his practice. So I took over his practice. I didn't own anything yet, and I worked for him for about 3 years, and then he stayed on to mentor for another 5 years. But after the 3-year mark, I wound up purchasing his practice. And then since then, it's just evolved. And I think there is such a need for myofunctional therapy, but there's such an overall need for speech therapy in and of itself. And at the beginning, it was a lot of resistance because ASHA had come out with the position statement that it wasn't working. And it was a lot of battles. Even when we were hiring therapists, they were not believing in the therapy. So then okay, well, I can't have you provide something that you don't believe in, because,
100%.
I just didn't feel that comfortable doing that.
Yeah.
And now I feel like more and more we have our own in-house program just from all of the courses and experiences. And I feel like now therapists come to us for that reason. Right? Like
Yeah, they
specifically.
want to know more about myofunctional.
Yeah, that's fantastic.
Yeah,
So it's changed, isn't it? It's nice. It's a nice feeling to now.
Yeah.
Yes, you're able to now be, you're not pushing it uphill all the time.
Right.
Resistance.
Yeah,
Pretty
it's
cool.
still not something we learn a lot about in the graduate schooling. So when we get they're clinical fellows straight out of graduate school, they've sometimes never even heard the word myofunctional therapy either. We do, like, I will lecture to a lot of graduate programs so that I could start to tell them a little bit about, listen, there's this thing called myofunctional therapy. You can have a course on it, but you're going to want to know more, and kind of give a little overview of it, because it's so important, but it hasn't reached, the educational level much. Although our board exam does have a few myofunctional questions on it in the last few years, which is, good to see.
And is beyond crazy, because it's not being covered in school. These individuals are taking this test, never hearing the word, and now they have to answer questions to see if they can get their license. Why answering this question? It's
transition phase.
Absolutely. Absolutely. You want to tell your journey, how you got here?
My journey, I would like to say myofunctional therapy found me.
Yes. And then I just hung on for dear life.
I worked with Janine for my clinical fellowship. So that was my first, straight out of grad school. And then I ended up being her myofunctional evaluation assistant. And I supported her with those evaluations that came in for the practice. And then probably did that for 5 years, maybe a little bit more. And then in 2020, that was when I took over Janine's role and became the myofunctional specialist for the practice. So
amazing. Nice work, Janine.
Yeah, thank you. Like I said, hold on, but dear life. Yes, I couldn't ask for better. I really couldn't.
Great team. Love it.
Yeah. Willingness to always learn, and I do see that it's different with this generation. They don't really want the education. They would rather just sit back and like everything come to them rather than seek these opportunities to learn more and to grow more. So Toni-Ann was definitely the exception to the norm. But I do hope that changes in the future. I know here, I think they've realized now that grad school is business, a lot of these universities, and they're taking in so many students, and they're not coming out as prepared as they once were.
Yeah, absolutely. That's right. When universities become business as opposed to making sure that they're going to go out and then that's disillusioning for them as well, to get out and not be able to come out with that passion and interest when you've spent all the time studying to become, a specialist in this field. That's a depressing thought, really, isn't it? Whereas, we've all obviously had this curiosity and lust for learning, and just, there's always more to learn. You sort of always just feeling like,
always.
kind of, trying to settle back a little bit from going continually. Let some of it integrate. Let some of it integrate, and just,
Agreed. Absolutely.
Down the track.
Speaking of stories, we'll also say to those listening, then we had the pleasure of meeting you at a conference, and Melissa Mugno said, you guys need to have dinner, and we went to dinner, and I think all we did was laugh and joke the entire dinner. And we knew that we were gonna, be able to really collaborate well. And that's something that the three of us are really passionate about, is that Munchee and Spot Pal go so well together. I use it clinically all the time. I love when my patients are doing their Munchee for 5 or 10 minutes and then follow it with popping their Spot Pal in to really now work on that stabilization of oral rest posture. So it's been really, really great to know that these tools can all work together. We're all here to help and, do the best to allow our patients to thrive and have that well-being that they deserve.
Absolutely. And I think tools are these homework tools that are simple, and yours is very simple, and ours is pretty simple, this idea. And that just so powerful when people just get into a routine and do those things, the brain really starts to get a hold of that. And I just had a thought about what's happening between 5 and 8 months of age for a baby. It's all the tongue lateralization and the chewing responses. And that's probably part of why they go so well together, because actually they should have been wiring in at the same time. So all of that neurology that's in there around those cranial nerves to do those things, it's all about. So I just think, that's probably why they had that.
I never thought of it.
Right.
Absolutely. I never thought of it like that.
I love
but
that.
That's really, yes, absolutely. Very, very interesting. It is so important. And I think even from the perspective of the jaw movement, when it comes to articulation, if you're not able to grade your jaw, it's going to be very difficult to produce certain sounds. And if there's a lot of jaw instability as well as tongue weakness, their child is going to be up against a brick wall. And that's those patients, if they're being seen in an academic setting for their speech sounds, the clinician will be working with, day in and day out for years and would make progress in the therapy room. But then second the patient stepped out of the therapy room, it was gone. And the therapist didn't know to identify whether or not it was related to, and if myofunctional therapy was needed, and make that referral. So I still feel like we have a lot of work to do within the speech pathology community, with regards to that educational piece, and letting them, again, just going back to what you said, like, how important chewing is, utilizing Munchee, how important rest posture, like all of those things. I think we all took for granted as SLPs, just because, like you said, there's just so much that we're learning. But when you focus on one thing, you start to realize all these contributing factors. You start to realize where the limitations are, what is needed. And it's really eye-opening. It's eye-opening for us, and we hope to be eye-opening to anyone else that's listening.
Yeah, and I think what's interesting too, I don't imagine that you two would have people on your caseload for years on end who weren't making progress.
Right.
I think this is the other thing, is understanding, and as practitioners going, something's not quite right here. This is not going where I expect. What can I do? And you're obviously problem solvers as well. You're going, okay, how can I get a better outcome here for this patient? And that's got to be what we're all working towards. And I don't understand how in Australia, we've got a thing called the National Disability Insurance Scheme, and it's crippling the country because there's all these people on the NDIS. For many, I don't think there's enough of these stringent goals in place of making sure they're making progress to make sure that it might be evidence-based to do that particular technique, but is it getting anywhere? And this is where myofunctional therapy and the work and these tools we're using, game changers.
Yeah.
Game changers. They can absolutely come in and allow that system some scaffolding to get it to the next level.
Yeah.
And that's got to be looked at, because I just get driven crazy by that. I'm like, surely they can't be on that caseload for years and no change. Don't do that. If you're not getting somewhere, come on, let's find what else they need. There's something else that might be needed first. Not to say what you're doing isn't right, but the system can't load it, can't load that program.
Yeah, couldn't agree more.
And you have to be able to, whether it's the pediatrician or the pediatric dentist or the orthodontist or the speech pathologist or the dental hygienist, someone has to be able to identify the issue as early as possible, because by the time they get to us and we're saying you need to consult for a frenectomy, your palate's too narrow, your chewing patterns immature, now they've had this habit ingrained for how long? And now it's like they're starting from scratch. And as a parent, I understand that being very disheartening. And of course, they'll always say, like, why didn't the doctor tell me this? Why didn't the dentist tell me this? Because in the grand scheme of it, we're just practitioners, that we don't hold a medical degree. So as much as our word matters, it doesn't matter as much as the doctor and the dentist. So trying to get them on board so that we could really be involved in early intervention, I think, is key.
Yes, because that is the thing, is spotting it. That's what they're talking. So it is. But I think what's going to happen, because is the parents are going to demand it from they're going to turn up at their physician's appointment, whether it's doctor or dentist, and start talking about these things. And hopefully what will happen is that they'll go, oh, I better go and learn about that, because I've had 3 people this week ask me about it. So that's what, over time we'll see, and we can then really support the parents. That's what's great. There's enough practitioners out there. Well, there's probably not enough, actually. There's nowhere near enough. But there's some practitioners out there that can support them, which is really important, is that once you highlight these dysfunctions that are going on, is then making sure there's something that can be done. And that's where your tool and my tool are really helpful, because we don't actually need to be one-on-one with a therapist all the time to get benefit from it. And I think that's what's so helpful, because we don't have enough one-on-one therapists to do all the work that's needed.
So true.
For people who've just got dysfunctional habits. If they haven't got big symptom pictures going with it, but they can see that it's there, this is a perfect combination for them, a Spot Pal and a Myo Munchee, to help them get better function. I think they're really cool having tools that can do these, support people who have worked it out.
When Spot Pal was first created, it was to be in a myofunctional or speech therapy session, because that's how we used it and that's how we saw it. And then when it went public, we realized, wow, there's people that are coming to Spot Pal because there's no myofunctional therapist in their entire state, or there's one and she has a 3-month wait list. We don't always realize that, because we're in this little bubble on Long Island that has 9 myofunctional offices, somewhere it's there, 20 minutes drive. But that's not where it is. And for a lot of patients, it can be costly, it can be expensive. They don't have the resources available to them. So between Spot Pal and Munchee, giving them something to be able to do is for sure better than nothing.
And especially too, I've just talked to a couple of people who are speech myofunctional therapists, waiting list. They've got a waiting list of 3 months, 6 months, whatever. This is a perfect tools for them to be utilizing while they're waiting to get into that specialized program as well. So things like that it's really helpful for, it's just like so many, like this, I can probably very limited number of myofunctional therapists in Australia and
Right.
very large distances
Wow.
between it. And you've got lots of people in the middle of America in lots of places as well that
Yeah.
would have no one.
Mhm.
So it's yeah, we've got there's a lot of work to be done, and yet these tools are, and they're never more powerful than in the hands of a clinician who's really
Yeah.
advising
Yeah.
about what else you need. And that's what I will always say. You will get a better outcome at a munchie
Yeah.
every time
Yeah.
when you're with a clinician.
Uh-huh.
And I definitely advise that if if you're trying to solve a problem, if you've got something, I would suggest to a parent you don't go first port of call to a munchie.
Yeah.
Munchie's a great tool proactively, really helps to strengthen lips, face, and jaws, but it's not going to solve the problem of a malocclusion necessarily, or speech dysfunctions or low tone. Better off in the hands of someone who's directing that
Right.
and giving you, because it
Mhm.
usually goes in conjunction with a few other exercises and
Right,
things that make a big difference too.
Right. But it complements those things,
Compliments.
it gives the
Yeah.
family something to do at home to practice and have that repetition and that really important side of things. And a lot of the times, especially, on where we are, families are busy. There's 4 kids in the family. They're running around from different practices. And in a true myofunctional manner, we want you sitting in front of a mirror, practicing, little rubber bands on the tongue. And sometimes it's not realistic on a daily basis for these families. And if we could say, hey, when you're in the car on your way here, munchie on this. And when you are doing your homework, pop your Spot Pal in, it allows them to still have that success, which is really important.
Yes.
Yeah,
And
absolutely.
yeah, it was when we did do it, like you said, we thought about it for myofunctional therapists. And I think it was Melissa who said, like, you're thinking about it the wrong way. And Toni-Ann and I were a little like baffled by that. And she's like, you almost have to think of utilizing like a Munchee and a Spot Pal with all the people that don't have access to myofunctional therapy. So we were thinking, let's do this 4% of the world that has myo available to them. And Melissa was saying, no, it's better by utilizing them together. And if a patient does not have access to myo, cannot afford it, at least they're targeting something.
Mhm.
So if
Yeah.
they're targeting one area, whether it be rest posture or posture and jaw stability, at least something's better than nothing. And that was a really interesting concept because when you look at how many myofunctional therapists there are, especially in the States, there's pockets where there's a ton, but there's mostly none. And outside of the US, I am baffled by how few countries have, whether it be Australia or Canada, or just mind blown that it hasn't gotten to that point yet. And even from Australia, I anticipated Australia to be so far ahead in the myofunctional therapy movement because all of those products come out of Australia. Prior to this, I'm like, who do we need to talk to in Australia? And there's not. It blows my mind.
No, absolutely. We're a very small population in the scheme of things. What are we, 30 million people or something? We haven't got a lot of people down here. So it's kind of crazy, and we're all concentrated on one section of the big island. But look, I think, and that's trust Melissa to, she comes at things, different angle. I like that. That she's always great.
She does.
She's got great
Speaking of
insights.
Melissa, right?
So if, those listening and parents, hopefully this reaches a lot of our own patient parents, how can they go about getting themselves a Myo Munchee or looking into the product more? How can they go ahead and do that?
Yeah, so we've got a website, myomunchee.com, and that's definitely worth going and having a little troll around. Lots of videos and info on that website. We've also, if you're a practitioner, make an account. Just go and make it a practitioner account, and then you'll get access to the practitioner portal, and there's loads of information in there. And we do have our education courses that we run, and that's what I've really developed, and what my big passion is. We have a great product, and that's great. But the education is the thing that I think will really make the difference. And this year, so we've got practitioner courses. We've got our 0 to 2, which is for the BB applications, for the BB protocols, for those who work with the babies. And then we've got our Myo Munchee practitioner protocols from age 2 years through to the elderly. And that's the great thing about a munchie. Super useful with children. That's my big passion, facial growth, getting upstream, doing what we can to prevent, but also super relevant as we get older. So I've got great applications in our protocols across the lifespan. And that's been something I've really enjoyed learning from and working with speech pathologists who work with older people as well. We've got Parkinson's, and I've had patients with oncology that we've talked through and case studies. There's all sorts of ways that the munchie is so helpful for getting that chewing, for salivary production, chewing for keeping the dysphagia, for keeping the activation of the pharyngeal walls, all the different things. So our education platforms are really trying to give people so many different opportunities for application, and they're across all the different practitioners. So everyone can do our courses, and we have presentations from all the different people so that you get exposure to different things. And I've really, as I say, the speech pathologist has been one of the most interesting spheres I've hung out in the last, 5 to 10 years, because prior to that, why would I ever go to a speech pathology conference? And it's almost the biggest misnomer. You guys do so much other stuff besides articulation. There's so much other, and that's the obvious bit you do, and that's really complicated. But then there's all the other aspects around feeding and swallowing and all the things. But so we cover a lot of that in our programs. And then this year we're going to be launching some direct to public education pieces to really help for those proactive parents who want to get on board and go, okay, great, I want to be proactive around this stuff. I want to get, that's who we want to work with, and just make sure the first little bit of a sign, we start to get onto things. Okay, they're not quite, we can see that they're mouth breathing, or we can see that, they've got a thumb sucking habit that's not integrating, or, things like that. We want to start giving them a bit of support early on. Right. So go to our website, check us out, and then you're a practitioner. Definitely sign up for an account.
Yes.
Well, honestly, thank you so much for joining us tonight. I could literally sit here and talk to you all day. I just find it's so interesting, and how it's evolved, and the protocols that have been devised. We're 50 years behind you. Your dad started it. So I look to you guys as like where we need to get to and where we want to be on all fronts, whether it be our exposure or the educational piece. So thank you for being a role model to us and helping us to strive for something. That means a lot to us.
Mm-hmm.
Oh, Janine, that's just makes me feel profound. But you've developed the product. I had the product. You're doing all of it, but that's great. If I can give you a trajectory of how to do my bit, you've done the hard bit of popping it, and you're an inventor, which is fantastic. But thank you for having me.
You're welcome. You're welcome. So it's really nice. Hopefully we get to talk again soon. We'll catch up at a conference or something in the new year. Otherwise, you always keep in touch. We love to hear from you.
Yes. We'll be in touch soon about more collaboration.
Oh, well.
Absolutely.
Right.
Good night, Mary.
Bye.
Bye.
Thank you for joining us on this episode of Talk the Talk.
We hope it was enjoyable and educational, and further supports you both personally and professionally.
For more information, please check out our Myo and Myo Minute podcast, as well as our other episodes of Talk the Talk. And don't forget to check out our tongue training appliance, Spot Pal, to help with tongue thrusting, thumb sucking, snoring, TMJ, mouth breathing, and so much more. Visit thespotpal.com.